Stephanie Belflint joins us now to talk about hip replacement. And if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Trevor Pickering. He is with Mississippi Sports Medicine, does a lot of operations at Baptist Medical Center. Thank you for joining us.
Thank you for having me.
Hip replacement has become, no surgery is simple, but in terms of where it's come, it's more precise and it's much simpler.
That's right. There have been great strides over the last 40 years and especially over the last 15 years as far as decreasing the incision and increasing the patient's ability to get up and move around quickly after surgery, decreasing the time in the hospital, and really getting them back to where they want to be quickly.
Do you do hip surgery more laparoscopically now, or do you still have to use incisions?
We still use incisions. We haven't figured out a way to do it through the scopes and the cameras yet, but who knows, that may be on the horizon. But we have developed ways now where we can avoid taking down any sort of muscle in order to get people moving quickly and avoid getting in, avoid having to put them on limitations afterwards with their position.
Well, show us this procedure that you're talking about here today.
Well, he's got a new table or something.
Okay.
Well, we do. You know, Baptist, where we perform a number of our surgeries, has acquired this table.
Oh, my goodness.
Called the Hana Table. And what this table does, yeah, it looks a little odd, but it's actually a great innovation. It allows us to position the patient in such a way comfortably that we can do what's called a direct anterior hip replacement. And in this particular way of doing hip replacement, unlike with prior positioning, we can do the hip through a very small incision on the front of the thigh rather than on the posterior of the thigh. And by doing so, we avoid taking down any muscles, and we give the patient tremendous stability, and they're able to get up quickly after surgery and resume their activities much more quickly than traditionally. And they have no hip precautions. They don't have to avoid any positions of sitting, standing, or stooping over after their hip surgery.
Oh, that's a really good improvement.
This has been
the
a
guy down there,
tremendous
is he your co-pilot?
Yeah, he's in the OR, and he is controlling the leg so that I can have access to the positioning that I need. And what this does is it saves us having to have additional personnel in the room. We can just have this one individual in there, and we don't have to have 2 or 3 in there, and that's been extremely helpful as far as reducing infection and making the whole procedure much more efficient. Now,
when do you know that a patient needs hip replacement? I think a lot of us really associate it with an elderly patient, but that's not necessarily true.
That's right, and you know, we're finding now with baby boomers that patients are wanting their painful hips fixed earlier so that they can enjoy the activities they want to do, you know, earlier in life. Really, arthritis can affect patients very early on, after their 40s. And the decision to perform a hip replacement is made between the physician and the patient. It's a very personal decision on the patient's part. When they're no longer able to do the activities they want to do, when they can't sleep, they can't play with their kids, they can't golf, climb a deer stand, stoop down in the garden, that's the time when we recommend a hip replacement.
Okay, we've had a viewer ask, please explain resurfacing. Hip
resurfacing is similar to hip replacement. Instead of, for example, in a traditional hip replacement, I don't know if we can see this, the diseased portion of the ball is removed and replaced, and in a hip resurfacing, rather than replacing that, we simply put a cap over the patient's existing bone. And hip resurfacing has been around now for a few years. It's gotten good results in the right hands, and it's always an option as well.
All right, and the one thing that you said about that new operation that you're doing on the hip table, but prior to this, people could not stoop down for like 6 weeks or so?
That's correct.
Because it may pop out of joint.
Right, that's correct. In the United States, most hips, really since the inception of hip replacement, have been done through what's called a posterior approach, which is towards the back of the hip. And to do that, certain tendons and muscles that stabilize the hip have to be taken down and then repaired, and therefore bending forward and flexion or stooping forward were things that patients had to avoid actually for much longer than 6 weeks. So with this new approach, which is called the direct anterior hip approach, that's no longer the case. They can go ahead and do anything they want to.
Dr. Trevor Pickering with Mississippi Sports Medicine, thank you so much. Interesting gadgets you got there at Baptist. For more health news, you can log on to our website, WLBT.com, and click on Medical Matters.